Yeah.
Good morning, everyone. Can everyone hear me? If you could just type something in the chat if you hear me, please. All right, great. Thank you for coming to our first virtual children's camp seminar. This is my first time using Teams, so bear with me if there's any mistakes. We have some speakers today. We have Lisa Seymour, which most of you probably know. We got Bob Como, Director of VMS, Jeanette Baldanza, which is one of our nurses and immunization coordinator. I'm Danny Reese, I'll be speaking, and Leslie Pereno, Public Health Sanitarian, which most of you probably know as well. So first of all, welcome, like I said already. These are the things we'll be talking about today. Bob Como has to leave us a little early, so we're going to do a little Q&A session after the AED presentation. Everything else, we're going to do open discussion and questions at the end, so please write down your questions so you don't forget, and then we'll get to them at the end of the presentation. So next up, we have to assigned inspectors. I'll leave this up for a little bit so you know who your inspector. At this point, you should know who your inspector is. We've sent a few emails out already, so but if you don't know, here they are. And we'll get started with Lisa Seymour on the AED requirements.
So a new law, which is a public health law, takes effect May 21st of this year. It requires that all children's camps have an AED, which stands for Automated External Defibrillator. The law also requires that the camps have a plan to address any possible sudden cardiac event. The law also requires that you have AED trained staff. Now that should not be any problem for any staff member because all CPR classes now have the AED portion as part of a component of the class. So the AED location needs to be accessible when camp is in session at all times. You do not need to take the AED on any camp trips. So you want to ensure that your AED certified staff and all your staff are familiar with your plans regarding the AED. So there's 3 things that need to be submitted. We emailed all the camps the handouts regarding AEDs. One is a fill in the blank, which is the state template for safety plans, and it's called at the top AED plan. So that needs to be completed. Page 2 of that plan talks about an implementation plan. And the first link on that will take you to implementation plans that you can just download that are applicable. It might say for school or for sports organizations. Most camps may probably be the sports organization, unless you are a theater camp, you may want to pick the school. I didn't see camps specifically, but just pick the one that's most applicable to your camp. And then also a checklist regarding the AED needs to be submitted. If you Google AED checklist, or even as part of this link, there's templates that you could just print the checklist. So AEDs have pads, and pads have expiration dates. So the plan is to make sure that the AED is properly maintained, that it's checked. If it is put into use, there might be a sign out. So you can look, for the specifics of that. AEDs need to be registered with emergency medical services, which is what Bob's going to talk about, this collaborative agreement. And you may also want to register your AED with the manufacturer, as there may be recalls possible, and then you would be notified. So we approve the AED plan, the implementation plan, and then you submit what's called the collaborative agreement. So the Hudson Valley Regional Emergency Medical Services has this PAD or public access defibrillation collaborative agreement that needs to be completed. So submit the original to the Hudson Valley REMS. The address is at the top of the handout that was emailed to all the CAMs. If you have questions, you can call Bob or them directly. If you submit the plan to us, but then make changes later, I would submit that updated plan also, so that we have the most recent plan on file for your camp. And then anytime there's changes to your safety plan, you want to make sure you update your safety plan checklist. So you can add right in AED. Page 1, bottom has some extra space. You could just squeeze it in there. And then I would label each portion of the safety plan. So if you wanted to label it Appendix 1 as the AED plan, Appendix 2 as the implementation plan, Appendix 3 as the collaborative agreement, and submit that as your safety plan update. And then remember to sign and date page 2 of the safety plan checklist anytime you make a revision like that. So hopefully, you know, this would help during any cardiac emergencies and could save a life. So it is very important to make this update. So next up is Bob Cuomo. He is the Director of Putnam County Emergency Services. Welcome, Bob.
Thanks.
Guess you're gonna, okay, you're gonna advance the slides. Okay, good morning, everybody. Hope you can hear me. So I'm gonna talk a little bit more about the collaborative agreement and everything. But first, I just want to go over, you know, the importance of this in general, because I think this is, it's important that you guys have access to this. Because now you may be thinking, you know, summer camp, you have a lot of young kids there. They generally tend to be healthier than adults. So the likelihood that they're going to go into cardiac arrest might not be as much, but that's not necessarily the case. First of all, you do have adults on site. And secondly, even though kids don't suffer from heart disease as much as adults do, there are other things that can lead to cardiac arrest, such as electrocution and a condition known as commotio cordis, which, if you remember the football player Damar Hamlin, that was a really high-profile case where he took an impact to the chest and he immediately went into cardiac arrest, into ventricular fibrillation. And if it wasn't for the fact that there was an AED on site, I'm not so sure he would have had the good outcome he had, because the sooner that you can defibrillate somebody when they go into a shockable rhythm, the better the chances of survival. In fact, if somebody goes into cardiac arrest and they're in a shockable rhythm, like ventricular fibrillation, and for every minute that goes by that they're not getting defibrillated, their chance of survival goes down 10%. So that's 10% for every minute. So if you think about it, if somebody in cardiac arrest has to wait 5 minutes to get an AED applied and be defibrillated, then they have a 50-50 chance. If they have to wait 10 minutes, well, then they basically have a 0% chance, according to the statistics. And the fact that you will be having AEDs on site, you're definitely going to be able to have an impact on that, because you'll be able to deliver that mode of treatment pretty rapidly. And that's going to make the difference. So it's really important that you know the reasons why this is, you know, this is now mandated. In fact, it's, you know, years ago, it was also mandated for schools for the exact same reason, because there were 2 cases in high schools where at sporting events, 2 players got hit in the chest, I think with a line drive, and both of them went into cardiac arrest. I mean, it was 2 separate events. Both of them died, and there were no AEDs on site. So that's what spawned the Department of Education to make this a rule. So this is definitely a good thing. So this collaborative agreement that you have to have executed first goes to the Hudson Valley Regional EMS Council. And there's actually two parts to it. The first one is what you see on the screen now, is the actual collaborative agreement. And basically, it's a document that establishes a relationship between you, the entity providing public access to fibrillation, and a medical authority that we call an emergency healthcare provider, or EHCP. Now, that EHCP can either be a physician who's knowledgeable in emergency medicine, or a hospital, in which case, even if it's a hospital, a doctor is probably going to sign off on it. Okay, so many times, because of the scenario, the EHCP ends up being a physician that is working in the emergency department of your local hospital. Okay, and in fact, for us, that being Putnam Hospital, that person is Dr. James Rodriguez, who has already agreed to be the EHCP and has already provided signatures for PAD agreements. So if you need to have this done, you can contact me and I can provide you with signed documents so that you can submit them to the regional council. And as you can see on here, on this first document, it's just it establishes the relationship between the agency. You put the agency's name and then the physician or hospital's name, and then each person has to sign it. And then obviously you have to comply with the things that are on there. And now if we can go on to the next one. The second piece to this, which also has to be filed with the collaborative agreement, is called a notice of intent to provide public access to fibrillation. This is actually a state form from the State Department of Health. And on here, you provide information about your agency, the type of agency that you are, the PAD training program. That's basically the type of CPR course that that your people are are enrolling in and taking. Whatever course you provide, whatever training your folks go to, it has to comply with the current American Heart Association standards. So certainly if you take an American Heart Association CPR course, and all CPR courses include AED training now, then obviously that complies. But American Red Cross also complies with that. American Safety and Health Institute and National Safety Council. Those are the ones that off the top of my head that I know the state accepts. If you're not sure if the state accepts your CPR training program, you can always reach out to me and I can find out for you. That's not a problem. Also on this document, you have to indicate how many AEDs you have, the manufacturer of your AED, whether it's Cardiac Science or Philips or Physio Control or whatever. And also whether they're pediatric capable. Now, a pediatric capable AED has a mechanism to reduce the amount of energy that it delivers during a shock. And there's two ways of doing that. One is with a special set of pediatric pads that you swap out for the adult pads. And the other one is you're using the same pads as you would for the adult, but there's like a key that you stick into the front of the AED, and that is what reduces the energy. So you can indicate if your AED is pediatric capable, and I would recommend that you get one that is pediatric capable. Although push comes to shove, American Heart Association does say that if you have a pediatric patient that needs defibrillating and you only have an adult capable AED, that you should still use it. But since you're going to have a lot of younger folks, you probably want to have a pediatric capable AED. You also need to indicate the number of AEDs that you have and whatnot. And then your emergency healthcare provider, you have to provide their information on this as well. And I also have signed, Dr. Rodriguez has indicated that he would sign this too and provide that information for you. And then both entities have to sign this. If you have multiple AEDs, even if they're in multiple locations, as long as it's a single agency or entity that's applying for public access defibrillation, you only need to submit one collaborative agreement. I've had that question before. If we have two locations, do we have to submit two collaborative agreements? And the answer is no, you only have to do one. And then what you do is once this is filled out, you send it up to the Hudson Valley Regional EMS Council. They check it for completeness, and then they forward it to New York State Department of Health, in which case puts it on file, and then you're good to go. It does not actually have to go through an approval process. As long as it's signed by you and the physician and it's completely filled out, it's basically a done deal. You do not have to update this. It's not like it has to be updated every year or every 2 years. The only time you have to update these forms is if you changed medical directors or changed the number of AEDs that you had. If everything remains the same, you can just keep the same old collaborative agreement. It doesn't need to be updated or renewed. There's no expiration on it. And I believe that's all I have when it comes to the AEDs.
Thank you, Bob.
I have one more comment. If your camp operates out of a school or another facility that you do not own and they have an AED, it is acceptable to use their AED. You still need to submit the AED plan, the implementation plan, and the collaborative agreement, but you are not responsible to submit the checklist and you are not responsible for maintenance of it. So the owner of that AED, hopefully you'll be able to collaborate with the school if that's where you operate out of and get some information regarding the AED collaborative agreement. Any questions on AEDs for myself or Bob?
So we have one question here. Can you provide Dr. James Rodriguez information?
Yes, I can do that.
Okay, so I'll have Bob email me his the contact for him, and then I'll email it out to you guys along with Bob's contact information, just in case you have any further questions on that. Anything else about AEDs before our one and only Bob leaves? This says, what about the third page, public access defibrillation QI report?
That's a document that you only have to submit if you actually use your AED. And that's supposed to go to the Hudson Valley Regional EMS Council. And that they basically track the AED uses to see how many times it's being used. Is it successful? You know, did the person have return to spontaneous circulation or not, and whatnot? And it's just a quality assurance or quality improvement tool. So you don't need to fill it out unless you actually use your AED.
Anything else? Last chance for now. Okay, moving on, we have Jeanette. She is our public health nurse and immunization coordinator. She will be talking about vaccine preventable diseases with a focus on measles.
So, hi, everyone. So as we know, childhood diseases are making a comeback, unfortunately. So there's been a measles outbreak alert. And measles is highly contagious. Somebody can get infected and just by walking through airspace. So we want to make sure that you're very aware of your campers and staff's vaccination status. We want to make sure that you try to avoid disrupting your camp season. And as we've noted here, one measles outbreak can close down your camp for 28 days. So you want to make sure you can flag all the files of any unvaccinated campers or staff so that you can separate them from any potential issue. Our current outlook is that in 2019, there was a concerning spike in measles in the United States, making it our highest annual count since the elimination in 2000. And as of May 2nd, the CDC has now reported 131 cases in 21 jurisdictions. So, and jurisdictions means states or territories. So, and to date, there's just been that one measles case sort of locally here. from a 3-year-old in Nassau County who was unvaccinated. So what we want you to be able to look for at your health centers are fever, unusual rash, very swollen glands, sore throat, difficulty swallowing, a constant cough or paroxysmal cough, which is when they cough to the point where they may vomit, and a consistent complaint of fatigue. So measles transmission, we just want you to know how highly contagious this is. It is the most contagious disease that we can prevent. So, and it's spread via droplets, so it's airborne. And it can live up to 2 hours in that airspace where somebody happened to have walked through and breathed, coughed, or sneezed. So it's so contagious that if a person has it, 90% of the people close to that person who are not immune can become infected. So, and infected people can spread measles to others from 4 days before they start even with some symptoms of rash through 4 days after the rash appears. So if you think it's measles, to further prevent the spread of measles, we're advising you to anyone who has symptoms that are consistent with measles that you know is unvaccinated or under-vaccinated. You want to contact a healthcare provider, the local clinic or emergency room where you're going before going for care. This way they can be brought in and prevent others from being exposed to any potential measles. So, and we want to make sure you have all of your vaccine records up to date. So we have a little flyer, I think, that we've sent out. We have posters of this that we will give you, and it has all the information about, you know, if you were considered immune, how many documented doses you need, and if you're not immune, you really should get vaccinated. Any questions?
A question about staff immunization records, just general.
We always suggest that you also have their immunization records so that you can know if they are vaccinated or what's considered under-vaccinated. In different countries, they have different rules. So, but pretty much it is universal that you should have 2 doses of MMR to be completely considered immune.
We will send out the measles poster. We'll probably also bring them out to the camps if you want us to. I don't know if we have
I
like
think we do.
high quality.
No, I think we do.
Yeah, so if you want them, just email your inspector and we'll get them out to you. Whatever way you want. Okay. So moving on is me. Who asked that? Nina had a question about the said once we send this to HBRC, we need to send it back to us saying it's completed and then submit to the health department. So she's referring to the QI, the third page of the so third page. We send this to HBRC, do we need them to send it back to us saying it was completed?
No. Well, they will probably, they might send you a letter saying it's complete, but if it's not complete, they will let you know what needs to be filled out. Yeah, it's not like it has to be approved or anything. They just need to make sure that the document is filled out properly.
All right, cool. So I'm going to be speaking about abuse allegation reporting. I know this is kind of like a complicated topic, so obviously we're not going to cover all the bases in like 2 slides, but hopefully this will help you guys understand better what needs to be reported, what doesn't need to be reported, stuff like that. So camps are required to report any allegation of abuse. So allegation being the key word. If it was said, it doesn't matter if it was true or not, you know, whatever the outcome is, you still have to report it to us. Sanitarians here at the health department, we make sure that the safety plan was being followed and any applicable codes from the sanitary code. We don't investigate, you know, criminal side of this. We want to make sure the camp counselors and directors and whatever it may be, we're doing the right thing at the time of the incident. We also don't decide if it was a valid situation or anything like that. We just make sure that you guys are doing what you're supposed to do. And a reminder is mandated reporters, you guys need to report the abuse allegations to the proper agencies as well. So some non-reportable allegations are physical altercation between two campers, unless it's, you know, extenuating circumstances like substantial age difference, multiple altercations, or anything you think that's kind of off-putting about it, then you can report it to us. Reports of consensual camper to camper sexual activity must be investigated to ensure supervision was adequate. So supervision meaning were these campers by themselves, like outside of cabins or in the woods, or not so much supervising the act itself. So that needs to be investigated. And reports of abuse not associated with camp's operations. I did have this was one of my facilities last year where a kid came to the camp and it ended up being, you know, they may have been abused at home by their parent or wherever it may be. So it was reported to me. I always say when in doubt, just give us a call, send us the report. I mean, it's always better to give us a report and have us put it in the non-reportable section of our files instead of not reporting it to find out it was reportable and then you have a violation for that. So when in doubt, just reach out to your inspector, talk about it, fill out the form, and just let us know. Because it is a pretty diverse set of situations that happen. So when in doubt, just give us a call. Any questions on abuse? This is specifically for the alleged abuse that happens on camp, correct? Camper says something happened at home, you usually report it directly to CPS. Yes, Will, that is correct. So if it happens at home, you report it to whatever agency you need to report it to. If it had nothing to do with camp operations.
And please make sure they realize if the report comes in after camp closed, they still need to report it to us.
So I don't know if you guys heard that, but if the report comes in after camp is closed, you still need to report it to us. If it happened next week. Yeah, Cheryl, that the abuse at home is a non-reportable. I was just saying if you are in doubt if it is or not, then you could always just ask. But it is a non-reportable if it's outside of camp operations. Any other questions? You're welcome, Cheryl. All right, up next we have Leslie with the Disabled Campers Code requirements.
Okay, so I know a lot of you that have been around for a while realize that it used to be the 20%. And I believe the DOH 367 or the A form still talks about the 20%, and they don't talk about what they made effective October 1st, 2016. And that's any camp enrolling any camper with a physical or developmental disability must comply with 7-2.25. And that's a additional section at the end of the code that discusses what the camp needs to put into place if they're going to accept or enroll a camper with a disability. And then this definition right under there in the smaller print just talks about the definition of what the code classify as a developmental disability. So I'm not going to go through everything that's in 7-2.25 because there's a lot, but some of the more important things are staff providing direct care with any of these campers with a disability shall be trained in the specific needs of that camper. So on top of your employee orientation, they need specific detailed orientation to the camper that they will be supervising. And then if someone indicates on their enrollment that their child has one of these disabilities, the camp must obtain individual treatment, care, and behavioral plans for that camper with the disability if it exists. If they say, nope, we don't do anything special, and the doctor signs off on that, then you do not create a care plan for them. So the confidential medical histories that you would obtain for all your campers, you must obtain those, but then you need to find out if there's any restrictions for that camper, allergies, medication, dietary needs, any pre-existing medical conditions, physical conditions, or psychological conditions. Then you must obtain their physician's name, address, and telephone number, and any special diet modifications relating to that disability. If they want to do a bathing activity like swimming, they have to have a signed permission slip from their parent, guardian, or residential care provider to do any of those. And then if they're doing any bathing activities and they're they're in a wheelchair or they have like leg braces, they have to have a one-to-one camper to counselor. So if they're in the pool, they have to have a specific person that is with them. And then all other campers with disabilities have a 1 to 5, so 1 counselor per 5 campers. There are special sections in the new the 2018 safety plan template that do discuss some of this as well. So if you're not using that the 2018 template, you have to fill that one out. And then there's other code requirements for like restrooms, sleeping facilities, and stuff that need to be not only approved by us, but you have to go through the building department for your town for those. And this is the safety plan template that I was speaking about. In the bottom, it should say 3/2018. If this is not the one that we've approved previously, then this must be submitted before you can get your permit this year. And your inspector will be in touch with you if this one's not on file, 2018.
So I did want to mention something else that came from State Health Department notified us of a drowning that happened at a water park involving video surveillance being used as lifeguarding, which is not acceptable by us or the state. So I figured I'd let you guys know that happened. I don't think any of you guys do that at your camps, but it's something to be aware of if you're taking trips to a water park or public pools or whatever it may be. Just know that video surveillance is not an acceptable form of supervision for swimming activities, which I feel like should be common knowledge. So at this time, you can bring up any questions that you may have had throughout the presentation, and we'll do our best to answer them. And Bob is still here, so. So Nina said, question on the new code for waterfront directors. Can you talk on this? And do you know if any organizations providing this training? Nina, what new code are you talking about, the lifeguard management courses? So I sent you the fact sheet that lists all the acceptable training courses for lifeguard management or a water aquatics director. So really sure the answer to that aside from it's listed on the fact sheet of what's acceptable.
You know, Carrie Hallian is offering a lifeguard training course. I think it might be. And if you have not received that from your inspector, you can request that she's offering it locally at Kiwi and at one other location. So you could sign up for that if you don't have it available someplace else.
I guess that looks like that's all the questions we have, so. Yeah, Nina, I'll send you that, the list of the training that Carrie's doing. Other than that, thank you for logging on and sharing this first time experience with all of us. Hopefully this was informative, and remember, if you have any questions, email us. We are real people with real feelings, so we will help you. That is all. Thank you.
Thank you. Thank you.